Good evening and welcome to the COVID-19 Making the Global Response Work in the Nigerian Context. I hope you all well in this challenging time. My name is Michael Brimore. I am the founder of the Diaspora Initiative for Nigeria's Development, DIND. My day job is as director of the UK-based organization Action for Southern Africa, which is the successor to the British anti-apartheid movement. DIND is work that I do in a voluntary capacity because of my love for Nigeria, work that I and a couple of others, I should say, do. I would like to thank our speakers for today's event for sparing the time to come and have this conversation with us. Today we have Dr. Mary Stephen, an expert in global health and health emergency preparedness and response with the World Health Organization. Dr. Mary will present on the epidemiology of the coronavirus and COVID-19 and share thoughts on the factors that will be necessary to consider in preventing it from becoming endemic in Nigeria. Dr. Emeka Anoje is an expert in public health and related program design and management. He is the project director with CDC FASTER at Catholic Relief Services in Nigeria. Dr. Emeka will give context to Nigeria's fight against COVID-19, including the impact this fight is having and could yet have on social and economic rights of Nigerians. Both our speakers for today are, of course, participating in this event in their personal capacities as true Nigerians and vastly knowledgeable and experienced professionals. Therefore, it is important to state that the views that they would express do not necessarily represent the views of the organizations they work for, unless, of course, if they so state. The views also that will be expressed during this event do not necessarily represent those of DIND either. Speakers would have around 10 minutes each for their presentation, and then we will have a panel discussion for much of the rest of that time. But we'll also have some live polls for you to do during the event. Our objective for this event is twofold: to inform Nigerians in diaspora about this pressing issue and its impact within Nigeria, and to engage them in the fight against the coronavirus and COVID-19. To help define a role for Nigerians in diaspora is the second objective. In particular, we want to look at how we might be able to advocate for more effective, tailored response to stopping the spread of the virus, and in helping to alleviate social and economic pressures that communities are facing as a real result of measures being implemented currently. It is our hope and our commitment that ideas that will come out of this event will contribute to the wider conversation on stopping the spread of the coronavirus and even in eradicating it altogether, and that diasporans will become actively engaged in these processes. Please, I want you to note that internet connection reliability differs from place to place, and should any of the panelists, our panelists today experience any difficulties, it may be necessary for them to exit the meeting and then rejoin us again. So please bear with us should that happen. During the event, you can send your questions by using the chat function. To find the chat function, click on the yellow-orange arrow on the top right of your screen. This will open up a dialog box with space for you to type your questions. All right, so without any further ado, I think we can straight away go into the event. We'll start with our speakers. First is Dr. Mary Stephen. Dr. Mary?
Hello, good afternoon, good evening, and good morning to all. I'm happy to be here as a passionate Nigerian as well. So I will be taking you to the epidemiology of coronavirus disease, as you heard from the organizer of this event. So what is coronavirus? Are we hearing about coronavirus for the first time, or has it been with us for some time? So coronaviruses are viruses that infect both human and animal populations. So normally they cause mild diseases, but we have seen coronaviruses in the past that cause severe disease, like the MERS-CoV, the Middle East respiratory respiratory syndrome, and then the SARS, severe acute respiratory syndrome. So now, This disease, if they are found in animals, they are called zoonotic diseases. And for the COVID-19, is one of the new coronaviruses that has been discovered, and it is named SARS-CoV-2. So that's the name of the virus, and the disease is called COVID-19. Next slide. What are the signs and symptoms? So for COVID-19, it could present asymptomatic, but when it presents with symptoms, the major symptoms are respiratory symptoms, fever and dry cough. When the disease begins to progress into severe illness, the patient will begin to present with shortness of breath or difficulty in breathing. It could also present with some non-specific symptoms, tiredness, body aches, and other flu-like symptoms. And nowadays we hear about the issue of loss of taste and smell. So how does it spread? So the main transmission pattern is from person to person. So basically by being exposed to the droplets of a sick person when he or she coughs, talks, or sneezes. It could also spread through contact with contaminated surfaces. So surfaces on which these droplets have fallen on, or somebody with contaminated hands has touched. So all these surfaces could be a source of contamination. So now the global situation, the coronavirus, as we all know, it has now spread to more than 216 countries and territories globally. And so far as at today, 3 p.m., there were 4.9 million cases with over 300 of deaths globally. Then the situation in the region. So in the African region, today we just passed the 100,000 cases mark. Over 39,000 people have recovered from the disease. Then we have recorded 3,000 deaths with a case fatality of 3.1%. And for the African region, most of the cases, over 50%, are actually coming from very few countries. These are Algeria, South Africa, Nigeria, Ghana, Cameroon. So for Nigeria, as at yesterday, there were over 77,000 cases with 200 deaths and 1,900 recoveries. The case fatality is also similar to that of the region, as is at 3.1%. And so far, of the 36 plus 1 states, 35 have been affected. So what are the recommended public health interventions for this COVID-19 outbreak? So first of all is having a robust surveillance system that can help a country to detect these cases early and test these suspected cases. Of course, if an individual is found to be positive, then isolation and treatment of the confirmed cases. Therefore, this will be followed by contact tracing. So what usually happens is that when an individual is identified as a suspected case, it means that the person has met the case definition. So the contact listing of that person will start already before the laboratory result is out. And once the laboratory result is out and is positive, then the contact tracing and follow-up of these people will start immediately. So they will be informed that they are contacts of somebody that has just tested positive, and so they will be advised to self-quarantine at home, and then they will be followed up for 14 days. Upon completion, a test will be done to determine whether they are positive or negative. But the testing strategies vary from country to country, but this is what usually happens in the African region. So what are some of the preventive measures? So we all know that there is currently no vaccine for COVID-19, So the best way really is to stop or to avoid being exposed to the virus. So what do we do? Washing hands regularly with soap and water or alcohol-based hand sanitizer, staying 1 to 2 meters away from others, observing cough etiquette, avoiding crowded places, and the new recommendation is to use non-medical face masks when we go to public places. So COVID-19 treatment, just like the vaccine, there is no specific treatment for COVID-19. So patients that are admitted into hospitals are given supportive treatment. So mainly addressing the symptoms they are presenting with. If they are presenting with fever, they could get antipyretic. If they are already becoming breathless, oxygen concentration is very low, they can have oxygen supplies. So basically, but there is no medicine, specific medicine that treats the virus itself, but an individual can receive supportive treatment if there is a superimposed bacterial infection or septicemia. Then the person can have antibiotics. So basically just treating those symptoms without necessarily addressing the virus itself. So right now there are 4 regimens that is currently undergoing randomized clinical trial. So there are 5 drugs in that: remdesivir, chloroquine and hydroxychloroquine, lopinavir, rotinavir, and then the last combination with interferon. So these are drugs that are already known. The last 2 drugs are actually used for HIV/AIDS. Of course, chloroquine is used for malaria. We know that. Remdesivir is one of the new drugs that was developed during the 2014 Ebola outbreak in West Africa, and it has been tried in DRC. So it has not shown to be effective for the Ebola virus, and so it was dropped from the clinical trial. But it is one of the drugs that is currently being tested for COVID-19. Okay, so to conclude, the coronavirus outbreak is still evolving on the continent. If you see from the epidemiological curve, both the regional and the one from Nigeria, you can see that the cases are still increasing. So we haven't seen the peak in Africa yet, not even in Nigeria as well. So the cases, the outbreak continues to evolve, but the situation is different in all countries. We have some countries in the region that are currently not reporting any cases for the past 6 weeks. But we still have countries that are driving the outbreak, like I said earlier, the 5 big countries. So all ages are susceptible, but we know that elderly people and those with comorbidities potentially could present with severe disease, and those are the same group of people where you have the highest rate of mortality. There is currently no vaccine and no specific treatment, and so our best option is to avoid exposure to the virus. Thank you.
Thank you very much, Dr. Mary. That is really, really, really interesting. Good presentation. We are going to have a quick poll. The poll will be launched by my technical colleagues, and once that is done, you just on your screen where you are, you respond to the poll, and then we'll put the result of the poll on. The poll should be on your screen right now. Should the Nigerian government make the Madagascar COVID-19 cure available to citizens? Now, many of you would have heard about the COVID-19 Madagascar cure. We just want to know what your opinion is, then we're going to listen to what our panelists think about this. One of the questions is, yes, I believe there's evidence that it's effective. Second is possibly, but only after successful scientific test. No, I believe there's no evidence that it works. And the last one is, I have no opinion on this. So please, if you could, just respond to the polls on your screen right now. And once that's done, we will continue. Okay. All right, I think that is done. Thank you very much. Let's put the result on the screen for everyone to see. So possibly, but only after successful scientific tests. 40% of people selected that, and 40% said they have no opinion on this, while 20% said, I believe there is no evidence that it works. So it's a no. All right, let's hear first from Dr. Mary. You've just spoken. What are your thoughts on this subject, please?
Yes, so there is actually currently a race to find a specific treatment for COVID-19, and we understand that. So the COVID organic from Madagascar has not been subjected to clinical trials yet. For the drug to be recommended for use by the general population, they will have to subject the medicine to randomized clinical trials to generate evidence on the safety, efficacy, and quality of the drug, because we don't want a situation where someone will take a medicine that might end up causing more harm than good to the individual. So this is the reason why we need the clinical trial to have a scientific evidence to back the claim.
Okay, thank you very much. Dr. Meka, do you have anything to add to that?
Yeah, thank you very much, Michael. Yeah, I wholeheartedly agree with my colleagues. And they had laid down rules for the process of validating new drugs and diagnostics. And the fact that COVID-19 is a global health emergency and a pandemic at the moment does not remove the requirement to go through the prescribed processes, right, in the interest of safety of the drug or the proposed remedy. So I think the government of Nigeria should subject it to the prescribed processes of trials and validation, and only make a decision that is informed by the outcome of that process.
Okay. All right. Thank you very much. That is really, really useful. I think the summary of it is it's wrong to outrightly dismiss it, and it will be wrong and irresponsible to also outrightly put it out for everybody to use. It needs to be subjected to rigorous scientific processes. Thank you.